Welcome back to the deep dive. Today we're tackling a really interesting molecule. It saves lives in hospitals, people use it for everyday wellness, but it's also sparked quite a bit of regulatory debate.
That's right. We're talking about N-Acetylcysteine, or, as most people know it, NAC.
Exactly, NAC.
And it's crucial we dig into this because, the sources show it's cheap, it's generally safe, and incredibly versatile.
Yeah, it seems to pop up everywhere, from basic cell defense to brain chemistry.
So our mission today is really to understand what makes NAC tick and why it's facing these regulatory headwinds in some places.
Okay, let's unpack that. For listeners maybe just seeing NAC on a supplement bottle, what is it fundamentally?
Well, chemically, NAC is just a modified version, an acetylated version of the amino acid cysteine.
Okay, cysteine, basic building block of proteins.
Exactly. Your body uses it all the time. Adding that acetyl group makes it much easier for your body to absorb and use. That's the key.
And this is where it gets complicated because it's used both as, an over-the-counter supplement and as a serious medicine in hospitals.
Precisely. It's on crash carts worldwide, and that dual identity is right at the heart of the regulatory tension we need to talk about.
Definitely. But first, you really can't discuss NAC without bringing up glutathione, GSH. That's central, isn't it?
Are absolutely central. If NAC is let's say, the delivery truck, then GSH is the vital cargo. Glutathione is, hands down, the body's most powerful internal antioxidant.
The main defender produced inside our cell.
Exactly. It's what our body makes to handle oxidative stress. If we want to neutralize that cellular damage, we absolutely need GSH.
So what controls how much GSH we can actually make? Is there a limit?
There is. Making GSH requires 3 amino acids: glutamic acid, glycine, and cysteine. But the research is really clear on this.
Cysteine is the key.
Cysteine is the bottleneck. It's the rate-limiting step. You could have plenty of the other two, but without enough cysteine, GSH production just slows right down.
And NAC's job is to supply that missing piece.
Precisely. NAC acts as that readily available precursor, ensuring there's enough cysteine to keep the GSH assembly line running smoothly.
I liked that term we found in the sources, the mother antioxidant for GSH. Why that specific name?
It's a great analogy, actually, because GSH essentially manages the whole antioxidant team in the cell. Think of free radicals as tiny little grenades going off, damaging DNA, fats, proteins.
In chaos?
Right. GSH is the bomb squad, neutralizing those grenades. And it's the mother because it also helps recycle and support other key antioxidant enzymes, things like superoxide dismutase, catalase. If GSH levels drop, the whole defensive network starts to fail.
Okay, that makes perfect sense. Which leads to the obvious question. If GSH is so important, why take NAC? Why not just supplement with GSH directly?
Yeah, the logical question. And that's the problem NAC neatly solves. If you just swallow a GSH pill, your digestive system pretty much dismantles it before it can get into your bloodstream.
So it doesn't get absorbed properly.
Barely at all. Almost zero bioavailability. It's just not effective taken that way.
So NAC is like the Trojan horse, getting the cysteine inside so the body can build its own GSH.
That's a good way to put it. It's the stable, absorbable delivery system that forces the internal production of the really powerful stuff, the GSH.
Okay. So we've established NAC is vital, effective, generally inexpensive, which brings us right back to that friction point, the regulations.
It really came to a head in 2020, at least in the U.S., when the FDA moved to prohibit its sale as an over-the-counter supplement. They classified it strictly as a drug.
And the reason wasn't safety concerns, right? It was more of a historical argument.
Exactly. It wasn't about new safety data. The argument was based on the timeline, that NAC was technically approved and marketed as a drug before it started being widely sold as a dietary supplement.
Sort of a who got there first argument.
Pretty much. It's similar to debates we're seeing now with things like NMN, other NAD precursors. It's a fascinating regulatory tangle.
And this isn't a global standard, is it? Access is different elsewhere.
No, it's quite patchy. In Europe, for instance, our sources indicate that NAC is generally still available as a supplement, both online and in stores. Access is maintained.
So given the strong safety record and its role in boosting this fundamental mother antioxidant, doesn't restricting access based on, a historical definition seem a bit bureaucratic?
Well, that's the crux of the debate, isn't it?
Yeah.
You have this compound that supports fundamental health, potentially prevents issues, and is low cost. The argument is whether that historical drug classification should override decades of safe use as a supplement. It's why this specific case got so much attention.
Okay, let's pivot to the practical benefits because this is where NAC really shows its range. A lot of people first hear about it for breathing issues, right? As a mucolytic.
Yes, that's a very common use. Mucolytic just means mucus dissolving, and the chemistry is quite clever.
How does it work on mucus?
NAC targets specific bonds, disulfide bonds, within the proteins that make up mucus. These bonds give mucus its thick, sticky structure.
It's consistency.
Right. NAC breaks those bonds. This makes the mucus much thinner, more watery, easier to cough up, and importantly, less likely to trap bacteria.
Which helps prevent infections.
Exactly. And that's why it's noted as being helpful in reducing flare-ups in conditions like COPD, where excess mucus is a major problem.
Okay, so that's a chronic use, but you mentioned dramatic uses too.
Oh, absolutely. From chronic care to crisis intervention. Its most dramatic role is probably as an antidote.
You're talking about paracetamol overdose, right? Acetaminophen in the U.S.
Yes. NAC has been a literal lifesaver in those situations for, well, over 40 years now. It's standard hospital procedure.
How does paracetamol cause such damage, and how does NAC stop it?
It's a really intense toxic pathway. When someone overdoses on paracetamol, the body metabolizes it into a highly toxic compound called NAPQI.
NAPQI.
Right, and NAPQI just devastates the liver supply of GSH. It uses it all up very quickly.
Depleting the main defender.
Exactly, and without GSH to neutralize NAPQI, liver cells start dying rapidly. This leads to acute liver failure, which can be fatal.
And NAC comes to the rescue.
High-dose NAC, usually given intravenously in the hospital, floods the system. It rapidly replenishes the building blocks for GSH, allowing the liver to produce more GSH very quickly, neutralize the NAPQI, and stop the cell death. It's literally a race against time.
Incredible. So that's the acute life-saving side. What about the slower systemic benefits? You mentioned inflammation earlier.
This links back to its core protective role. NAC has significant anti-inflammatory effects because it inhibits a key molecule called nuclear factor kappa beta, NFKB.
NFKB. Sounds important.
It is. Think of it as a master switch that kicks off the whole inflammatory cascade in the body. By keeping NFKB activity lower, NAC helps dampen that chronic, low-level inflammation that underlies so many health issues.
It's amazing how one thing can work in the lungs, the liver, and systemically like that. We also saw notes about gut health, ulcerative colitis.
Yes, for ulcerative colitis UC, it's often used adjunctively, meaning alongside other treatments. The idea is it helps strengthen the gut lining, the intestinal barrier, and reduces inflammation there.
And patients actually notice a difference.
The reports mention improvements in things that really impact quality of life, like stool consistency, fewer nighttime bathroom trips, less blood, better control, and less abdominal pain. Real-world benefits.
And not just the gut, but reproductive health too, PCOS.
Yes, polycystic ovary syndrome. Some studies suggest NAC can improve ovulation frequency compared to placebo, potentially boosting fertility for women with PCOS.
Wow. And another thing was detoxification, wasn't it? Heavy metals.
That's right. Because of its chemical structure, specifically the sulfur groups, NAC is quite good at chelation.
Binding to things.
Exactly. It can bind onto heavy metals like cadmium, mercury, lead, forming complexes that are easier for the body to get rid of. This helps prevent those metals from building up to harmful levels over time.
Lungs, liver, gut detox. But the brain stuff is maybe the most fascinating. How does NAC affect things like addiction or impulsivity?
Yeah, the neurochemistry is really interesting. It seems to work by modulating neurotransmitter levels, specifically glutamate.
Glutamate, that's the main excitatory one, right? The go signal.
Exactly. And when you have too much glutamate activity in the synapse, when the brain is sort of overstimulated, that's linked to issues like OCD, general impulsivity, anxiety, stress, and significantly addiction.
So NAC helps calm things down.
That seems to be the mechanism. It helps restore a better balance between that excitatory glutamate and the main inhibitory neurotransmitter, GABA. It appears to reduce the amount of glutamate released, effectively lowering the volume in those circuits.
Is there solid evidence for this in addiction?
There's some compelling data. One study specifically looked at cocaine addiction, where people tend to have elevated glutamate levels. NAC supplementation actually lowered those brain glutamate levels.
That's quite specific.
It is. And maybe more broadly relevant, another study gave smokers 2,400 milligrams of NAC daily for 4 weeks.
Okay.
And it significantly reduced how often they smoked. So it seems promising as a tool for tackling impulse control issues generally.
Okay. One last area, athletics. Performance, fatigue. Does NAC help you in the gym?
The evidence here is a bit weaker, generally speaking. For the average healthy athlete, probably not much benefit. But there's a really interesting nuance.
Okay.
The benefit seems to show up mainly in athletes who start with low baseline levels of GSH.
Ah, so if their natural antioxidant defenses are already a bit low.
Exactly. In that specific group, NAC might actually improve performance, maybe by up to 15%, according to some studies. But if your GSH levels are already decent, NAC doesn't seem to add much extra for performance.
Interesting distinction. Any truth to the hangover helper claims?
Well, the sources mention minor effectiveness there, potentially reducing some hangover symptoms, especially noted in women, but probably not a magic bullet.
Right. Okay, let's summarize the practical stuff. Dosing and safety. What's a typical daily dose people use?
For most of these general wellness uses, the typical range is somewhere between 600 milligrams and 1,200 milligrams per day.
And safety-wise?
Overall, it's considered very safe. I mean, it's basically just a modified amino acid. The main side effect people occasionally report is some mild digestive upset, usually only at higher doses.
Anything else on taking it?
Oh yes, it's generally recommended to take it on an empty stomach.
Yeah.
That seems to help with absorption, getting the most out of it.
Okay. But despite the high safety profile, you mentioned some critical drug interactions we need to flag.
Yes, this is really important for listeners to know. NAC can actually slow down how quickly the body gets rid of certain medications.
Meaning the drug levels could build up in the blood.
Exactly. It could increase their plasma concentrations, potentially leading to more side effects or even toxicity if not managed.
And this applies to specific types of drugs.
Yes, the research highlights potential interactions mainly with certain statins, cholesterol drugs, some blood pressure medications, a specific diuretic, and an antibiotic.
Okay, let's be really clear on those specific drug names because just saying statins isn't enough.
Good point.
Yeah.
Listeners should definitely consult their doctor if they take any regular medication, but the ones specifically flagged in the research for potentially reduced excretion with NEC include the statins pravastatin, lovastatin, and simvastatin.
Okay, 3 common statins.
Right. Then the cardiovascular drugs, valsartan, digoxin, and elapril.
Blood pressure and heart meds.
Also the diuretic torsemide and the antibiotic erythromycin. It's a crucial list to be aware of. Always check with your doctor.
Definitely. Okay, so wrapping this up, we've explored NAC, this, well, surprisingly versatile compound. It's cheap, generally safe, fuels our core cellular defenses. It ranges from helping clear airways and detoxing metals to literally saving lives from overdoses and maybe even helping balance brain chemistry.
It's quite a range.
And if there's one key takeaway for you listening, it's probably understanding NAC's role as the direct precursor to glutathione, that mother antioxidant. So much flows from that core function.
Absolutely. And that brings us back to that bigger picture, that final thought for you to consider. Given everything we've discussed, NAC's wide benefits, its strong safety profile, its affordability, its availability in many places. How should we think about these regulatory definitions?
Drug versus supplement.
Right. How might labeling something strictly as a drug impact public access to what seems like a really useful low-cost tool for preventative health, especially when it boosts our body's own primary defense system?
It's a really complex question with potentially big public health implications.
It is definitely a regulatory situation worth keeping an eye on and maybe exploring further yourself.
A perfect point to end on. Thanks for joining us for this deep dive into NAC.
My pleasure.
We'll catch you on the next one.